get it first. I get it. I get it first. Yeah, I was like telling somebody last semester.
I
told me, okay, is there any kind of down payment? I know, I give them to you, but just give me something. Give me down payment. Give me some books now.
How come you don't like number 12?
Some human being.
It's good. 11, 13, I guess.
11 to 13.
Yes. Yeah.
What?
He did.
What is that? Exam. You made a mistake, but which one?
That doesn't. Typing mistake. You know, I skipped 11, like 11 to 13. I skipped 12. Anyways.
How we didn't even notice. That's funny.
It's nothing to lose.
Don't worry, please.
So we have the epididymis, this structure. So when the sperms are formed here, they will move to the epididymis in that area. Okay. Here. Then after that, the epididymis is a storage area. Yeah. The storage of the sperms. The sperms will be, after they form in the testicles, they'll go out to be stored here in the epididymis. Then when the time, when the time is due and, the sperms, decide to move on, they go from here, here, and they go up in that duct. Okay, this duct is called ductus deferens or vas deferens. Ductus deferens or vas deferens, you will see it written somewhere here. Yeah, here we go. Vas deferens or ductus deferens. Here. And it goes all the way up. It leaves now, it's going to go inside your body. Okay, so it's going that way. Okay, so ductus deferens or vas deferens. But in reality, this is not alone. This ductus deferens and or vas deferens is not like that. In reality, it's going to be like that. Like this. Within, running within, or covered by a membrane, like in here, and it's moving with blood vessels. Testicular artery and testicular vein. Testicular artery and the vas deferens, and the blue one is going to be the testicular vein. 3 of them running together and covered by a connective tissue. 3 of them, the vas, the artery, testicular artery, testicular vein, 3 of them running together and covered by a membrane and given a name called spermatic cord. Given a name called spermatic cord. Okay, giving a name called spermatic cord. The spermatic cord is the main structure. You dissect it and you open and you'll find inside, you'll find the vas, you'll find the artery and the vein. 3 of them moving together in that spermatic cord. Let's go back. Okay, and all these things are what I call it the conduit, the transportation, the ducts that transport sperms. Okay, take sperms from one station to another, one station to another. So we moved from the testicles or the tests to the epididymis, to the vas deferens or the ductus deferens. Okay, all the way up. Okay, we're gonna go to the back of the urinary bladder. This is the urinary bladder, by the way, in here. And behind the urinary bladder, that area you have the rectum. Okay, and sigmoid part of the sigmoid column. So the vas deferens goes all the way up, and make what you call here a tube called the ampulla of the ductus deferens or the vas deferens in that area. And you have a gland behind the bladder, this gland called the seminal vesicle or the seminal vesicles. This gland. By the way, this gland responsible for secreting 60% of your seminal fluid. When you hear the word semen referring to sperms plus the seminal fluid. And this seminal fluid is very essential for the survival of the sperms. This is a nutritional medium of the sperms. Okay? And that 60% of this seminal fluid is composed in the seminal vesicle in here. So you got sperms running here, all this sperms only, sperms. Okay, the vas difference, ampulla of the vas. Okay, so you're gonna secrete him here. If you look at this, the seminal vesicle, it opens as well. Both of them, they join together. So here you go. At that point, for the first time, is the sperms when they meet with the seminal fluid. At that point, the sperm is coming here. The seminal fluid coming here. Here you go. So this is a good moment for the sperms. When they meet the seminal fluid, when they get in that medium, in this nutritional medium. Okay? And this duct, which is formed by a duct coming from the seminal vesicle, the ampulla of the vas, they make one duct, they join together to make one duct, and this duct called ejaculatory duct. This duct is called ejaculatory duct. Here we go. And this duct will open into the urethra. Okay? This duct, the urethra is right there. This is a bladder. Don't forget, this is a urinary bladder, and the urethra is right here. All this is urethra. All this is urethra. All this is urethra. In the male. The ejaculatory duct here. Okay? That's why, because of the ejaculatory duct, as males, we use the urethra for both urinary and reproductive. Urinary for urine, reproductive for seminal fluid and or semen and ejaculation. Because of the ejaculatory duct, and that's the name. Very makes sense. Ejaculatory duct. That is a duct to allow the urethra to act for ejaculation. And if you look at it, it's running inside the substance of the prostate. This is a prostate. Laying under the bladder, as I will show you in a moment. Okay, so it's running, the ejaculatory duct is running inside the prostate. Okay? Opening into the urethra. And as I said the last time, the urethra will be divided into three parts. Part running in the prostate, called prostatic. Part running in the penis, spongy, and the little part in between, very little, called membranes. Called membranes. Okay? So the sperms will meet the seminal fluid here, and they will go all the way down to the ejaculated out.
Can you say that structure again? The
Prostatic urethra.
no, that one.
Which one?
Next to the gland. Move. No,
Ampoule?
behind the gland.
This?
No, behind the gland.
This? The ampulla of the vas difference right there. Or the ductus difference.
Ampulla of the vas ductus.
Or the ductus, yeah. So, yes.
So what structure control the secretion of the urine and the sperm not to go together?
That's the autonomic nervous system.
Ah,
Yeah, that's the autonomic nervous system. Yeah.
like
So,
stimulation.
yeah. The stimulation and inhibition. Yes.
But sometimes you can control it.
It's gonna
Some control what?
Yeah.
You understand her question first? She's asking about she's asking about what structure gonna, while you urinating, you're blocking ejaculation, and while you ejaculating, you're blocking urination.
Okay.
What's the structure that will control that?
ANS.
The autonomic, yeah.
Right.
That's exactly the same answer.
So, but
again.
the point, like in ejaculation, never mind.
No go.
So like sometimes it's parasympathetic, you can control it, right? But it's,
No, that's sympathetic.
oh, sympathetic.
Yeah, and that's why when you think about it, what is a system that does ejaculation? Sympathetic, right? What do you think the sympathetic will do in the urinary system? Don't forget, sympathetic block elimination of wastes. So sympathetic will block urination. So the sympathetic will promote ejaculation, block urination. The opposite is true.
Oh, the point and shoot thing.
Ah,
That causes inflammation. That causes inflammation, like those things.
What?
Come out. Like the urination after you ejaculate.
Inflammation where? I don't understand the question.
Oh, like sometimes.
Two things
after-
want to come out at the same time, that's not going to happen.
Like activity, you may want to come, but right after, like, there's inflammation.
Okay, maybe you would talk like, more
Mental note.
open. I don't understand. Okay, so and then we have, this. This is a gland. The seminal vesicle is a gland. The prostate is a gland. The prostate responsible for the other 30–40% of the seminal fluid secretion. So you have 60% from the seminal vesicle. You have 40% or 30% from the prostate gland. The prostate will secrete something, will add up to this seminal fluid. And of course, the ejaculatory duct is running inside the prostate, so that the prostate has to do something. Okay, so the prostate will add up to this seminal fluid. And then we have another gland in the root of the penis here called bulbourethral gland. In here, bulbourethral gland. The bulbourethral gland, the function of this gland not to make seminal fluid. Okay, the function during the sexual excitement, you produce some